My name is Ashika, I am 18 years old, I go to Northcote College and I would like to find out about careers within a hospital.
Ashika is off to Auckland Hospital to meet Leigh Anderson, a theatre nurse.
Hi, I'm Ashika.
Hi Ashika, I'm Leigh, one of the theatre nurses. Come with me and we'll show you.
Leigh has arranged for her to learn about 3 different career options within the hospital. First up, Ashika is going to meet Tony Vaslovic, whose responsibility it is to coordinate the surgical theatre bookings.
I was looking for something more challenging. I started working a day stay here at Starship, where I quite liked it, and I was there for about 3 years. This job became available. Surgical manager came up to me and said, would you be interested, which I was already interested. I applied for it and got it, which was quite good.
Hi Tony.
Hi Ashika, hi, nice to meet you.
Nice to meet you too.
If you have a seat, I'll show you what I do.
Sure.
Tony's role begins when a patient is referred for surgery by a doctor from within or outside the hospital. She enters the patient's details into the system and then books the operating theatre.
Did you want to enter that?
Sure.
Yeah, go for it. Okay. So,
This means liaising with the patient's family, plus the many specialists and departments who will be involved. Often Tony must also coordinate a series of procedures to occur before the day of the operation, such as x-rays or blood tests.
and if there's any sort of special equipment or anything that the theatre might need to know, or anaesthetic department, they all need to be notified beforehand, plus some of the wards as well. That is awesome. Okay. So once we enter all that, we would say, it's amazing how grateful people are, and it's great. And if you do that a little bit more for them, it's awesome.
A patient previously booked in by Tony is about to undergo an operation, so Ashika rejoins theatre nurse Leigh Anderson to begin the preparations.
You're a natural.
Theatre nursing has held some interest. It was a place I got sent as a placement as a nursing student. I was a bit nervous to start, but developed a real passion for it. Seeing the inside of a human body is always absolutely fascinating.
So it's the iodine within the soap that's breaking down the cell walls of all the bacteria, so that decreases the chance of our patient getting any infections.
A strictly prescribed sterile technique is used to minimise the risk of infection being passed on to the patient.
So we're going to get our tools of the trade ready, all right?
The next stage of preparation is to check that all the required instruments are present and to count them.
2 Leighs, 2 Babcocks, 4 Alice and 2 4-5 clips.
Why do we count?
It's safety really. It's to make sure that we've got everything that we need at the beginning, and also to make sure that we've got the same number of swabs and instruments at the end. Because the worst case scenario would be that that was still inside the patient. Okay, and that's what this little strip is here in the middle.
Okay.
That shows up on x-ray. Okay, so if we lost it and we suspected it was inside the patient, that black line would show up on an x-ray.
Once the instruments are laid out, Ashika can remove her sterile gown and gloves. She's now going to meet another member of the team.
Hey Ashika, my name's Lauren. Nice to meet you.
Lauren Reid is an anaesthetic technician, and her role is to work alongside the anaesthetist.
This is our anaesthetic locker. This is where we keep all our drugs that we might require. The most common one here is called propofol. This is our induction agent. So this is the anaesthetic actually to put her to sleep. So we'd have some of that. We have some sedative here. It's called midazolam. Okay, that's just like a calming agent just to calm you down. Obviously, people are very nervous having an operation.
Okay. Are the emergency drugs kept here as well? Or?
Yes, yep. We have an emergency drug drawer here. Probably one that you know well is adrenaline. Okay. We hope not to open this drawer for something like this, but obviously you never know what could happen, so you know we have it all there just in case.
Okay.
The patient has arrived, so it's time to bring her in. Reassuring her is an important part of the theatre staff's job.
Okay, Ashika, this is Freya. She's our patient today. Now I've already checked her in, okay, and I've checked that she's the right patient for today and spoken to her about what we're going to be doing. Okay, and how are you feeling? A bit sore? Got a sore tummy? Yeah. Okay, we'll get you sorted out shortly. My aim is just to try and comfort them, relax them. Obviously it's a really scary time for them. They don't know any of us, and you know, it's a big event in their life. There's an artery that runs up her arm here, so that's where we want to have it on. Okay, so we're just going to put this blood pressure cuff on. A nice snug fit. That's great. Just turn it on, so the auto button there, that's great.
Ashika will observe during the operation, so it's back to the scrub room.
You've got to be a good people person, somebody you can get on with lots of different people, good communicator. Common sense, I think, is a really big thing. You've got to react well in emergency situations. Obviously, with the training, you learn more of that, but yeah, be cool under pressure.
Okay, we right to start? Yeah. Lovely. Knife. Thank you.
During the operation, sometimes it's a real game of coordination, getting everybody in the same place at the same time, but mostly it's about patient assessment and caring for the patient. Patient status can change at any time, so you've really got to be on your toes to keep an eye on things and be able to respond to whatever's happening in front of you. It's a fascinating job. It's really, really interesting and you never stop learning, so that's a big reward for me. And you get the absolute pleasure of helping somebody and perhaps easing their journey through their operation. All right, Freya, your operation's all finished. Freya, how are you feeling? Tired? Okay, we're going to take you through the recovery room. All right, everything's going to be fine and your mum will be through there shortly. Okay.
Done really well.
It's all over now.
Ashika did really well today. She's a bit of a natural. She's keen and wanting to learn, and she was really good.
Out of all the jobs, I think the role of being an anaesthetic technician appealed to me the most. It's a job that I wouldn't have to study at university for a whole 6 years before I go into it. I can go straight into the job, work with people, learn about what it's about, and at the same time study.
To become an anaesthetic technician, you need a diploma in applied science through AUT. It's a 3-year extramural course that involves on-the-job training. To enter from school, you will need NCEA Level 2 Physics and Level 3 Biology or equivalent.
She definitely pointed out quite a few things on the referral. She asked really good questions and I believe she will go far.
To become a surgical booker, you need at least 4 years secondary education, and useful subjects to take include English, science and health. Computer literacy is essential, but most skills are learnt on the job. You need to be well organised and good with people.
Ashika did extremely well, most impressed with her efforts. She also developed a really good empathy with the patient and she showed herself to be really caring. She'd be a lovely nurse.
To become a theatre nurse, you must first complete a 3-year Bachelor of Health Science majoring in nursing. Useful subjects at secondary school include English, maths, chemistry and biology. Once qualified as a registered nurse, specialist theatre training is provided at a hospital.
Supporting local content so you can see more of New Zealand on air.